Well, welcome to week 6 of the chain programme. I hope you're all really starting to feel the benefit of exercising regularly and enjoying the spinning sessions. So, what we're going to cover in today's talk, we're going to talk a little bit about planning for the future. Because remember, exercise will be beneficial for your hip, but only for as long as you keep exercising. This isn't a one-hit wonder, so we want you to continue exercising after the course. If after this course you stop exercising, it's likely that your symptoms will start to return over the coming weeks. What's key now over the coming weeks before you finish the programme is that you start to put the plans in place about how you're going to continue exercising regularly. So we're going to talk about some of the barriers and facilitators for ongoing exercise. We're going to talk about alternate exercise options. You don't have to spin, there's lots of other things that you could do to keep your hip mobile and your symptoms under control. And then of course we'll give you an updated cycling technique tip at the end for you to focus on when you go in the spinning studio. So you've seen this slide before, but again it's emphasising that everyone with arthritis should receive education on why it's good to be active and physically active and exercise with your joint pain. And remember that actually only a very small proportion of patients require what we call medical or surgical intervention with either injections or the need for surgery. The overarching principles of the chain programme are to empower you as patients to self-manage your condition. So our aim has been to give you education and advice on how to manage your hip pain in a different way. Hopefully you'll have been reassured that actually moving and exercising your hip is good for your hip and will likely improve your symptoms and prolong, or in some cases mean that you never require surgery for your hip joint. We've done that through education advice and also a progressive exercise programme. And what we're hoping here is that you'll undertake these things on an ongoing basis and you'll get a lifestyle change whereby you'll continue exercising after the completion of the chain programme and you will continually manage your own symptoms. So, planning for the future. We need you to be thinking now about how you're going to exercise after the chain programme. Who are you going to exercise with, where you're going to do it and what plans do you have in place? It may be useful to look at this diagram. This diagram shows us the barriers to exercise participation. And many of them we've addressed through the weeks that we've seen you here on the chain programme. So hopefully we've started to change your belief system that exercise will damage your hip. In fact, the reverse is true. Exercise will help your hip. Hopefully we've given you some motivation and made you more optimistic about your hip condition and the fact that you can manage it yourself with physical activity and exercise. And in doing so, hopefully that's been enjoyable and we've increased your knowledge. What we are aware of is that we all have the best intentions, so we need to now look at those external factors at the bottom of the diagram. So what I'd recommend is finding ways to partners with friends and families, make a regular commitment to exercise with them. But also be realistic. If it's the winter, then you need to make plans to exercise indoors so you're not put off by the rain or cold. And if it's the summer, make the use of it. Get outside and enjoy the lovely weather whilst you're exercising. And facilitators to exercise participation are well known with people with osteoarthritis. We know that we need to give people with osteoarthritis the education and knowledge. We need to give them motivation and positive beliefs about exercising. And we also know that you have to think of things like your normal day-to-day life. You need to integrate this physical activity and exercise in a sustainable manner. So can you commute to work? Can you exercise with friends or family, children, grandchildren, whatever that may be? Use that social influence and environmental context to make it more enjoyable but also more sustainable. So why cycling? We've said throughout the course the benefits of cycling, and cycling does seem to be particularly good at addressing hip arthritis and hip pain. But as well as cycling, there are other options. You could walk, do group exercise classes, you could exercise at home in front of videos on the television or on the internet. You can swim or do hydro or aquafit, yoga or Pilates, racket sports, weight training, golf or even dancing. All of these things should be encouraged and you should get back to them if those are the things that you want to do and normally do. So in summary, low impact exercises such as cycling, swimming, yoga, Pilates, walking, exercise classes and muscle strengthening are all excellent to do. We advise against doing too many high impact exercises that can cause progressive loading or jarring of the joint, and some examples of those are given on the screen now. The other thing to bear in mind is that you may get more improvement from this exercise as time goes on. This quote from one of our previous participants shows that for this particular participant, they made their improvements after the programme. So you also need to realise that where you are at the end of the 8 weeks may not be your final destination. You can continue to make improvements over the coming weeks and months. So another reason to keep exercising as you continue to get more benefits of being fitter, stronger and healthier. Let's hear from one of our past participants who's going to tell us about their experiences of the chain programme.
I had a bicycle and I got on it, and I get on it as often as I can. I think I probably do 3, maybe 4 sessions, but they are within my control and I don't have to come to the sports centre. I liked coming down to the sports centre, it was amazing, but trying to fit in appointments wasn't necessarily the easiest thing. But I could get out on my bike, and if I said now that I hadn't ridden a bike for 50 years, and I got on that bike and I learned how to walk, to be able to ride up the hill in over 6 months. And I never expected I'd be standing on a pedal to be able to get myself up and to keep my fitness going.
18 months on, following chain, that has become a new way of life for you, a new lifestyle for you in terms of riding your bike and being more active?
Yes, and it presents a discipline, because particularly when you do it with the bicycle and you're not inside, the weather recently has been pretty poor, so I have to really discipline myself to get on the bike and to have a spin round somewhere. But that's the principle of it, and I feel that I'm taking part in common sense help for what I've got, for the osteoarthritis that I've got. And I feel a little bit in control to the fact that I can notice it if I don't go regularly.
We're now going to give you some tips on a new part of the cycling technique that we're going to learn this week as we go into the studio.
Okay, so in today's session, I want you to concentrate on your upper body, and your upper body wants to be nice and relaxed. So starting at the top, take your eyes forward over the front of your handlebars. Think of pulling your shoulders back and down, pulling your chin in slightly, having a nice straight spine, and that you're sat towards the back of your saddle. Have slight engagement through your core muscles, and this will allow your diaphragm to lift and drop as you breathe in and out. As you breathe in, think of your rib cage reaching out towards the sides of the room so that you've got what we call lateral breathing, so as much oxygen as possible is getting into your lungs to be able to be sent round your body to your working muscles.
So, in summary for week 6, we summarised that cycling can offer many benefits to people with hip osteoarthritis, but so can other exercise options, and we'd encourage you to take on low impact exercise options and continue to exercise after the chain programme finishes. If there's anything you're unsure about, or if you've got other medical conditions that may stop you from doing certain exercises, have a check with your GP. I'm sure they'll be happy to advise. And importantly, find an activity that you enjoy. Make arrangements with friends and family, which means it's more likely for you to continue doing it. Enjoy the exercise that you do.